Once vaccines became available, many of us thought that COVID's end was near. Yet, with the emergence of variants, we are still battling the pandemic. This season, I continue to speak with community leaders, teachers, clinicians, and many more across the globe to connect with communities and hear their stories. This season, I bring you 16 and Vaccine. Hello, everyone. Welcome to this episode of 16 and Vaccine. Today, we are joined by Dr. Hamid Jafari in Amman, Jordan. Dr. Jafari is a world-renowned public health leader at the WHO, where he is currently the director of polio eradication. Dr. Jafari, thank you so much for joining me.
It's a pleasure. Thank you for inviting me.
So can you please share some details about your professional background with our audience, please?
So by training, I'm a pediatrician and specializing in infectious diseases of children. But for the last nearly 30 years, I've been purely doing public health. And within public health, mostly immunization, education work. That's been the bulk of my work. But I have also worked on global health security, which means that how do prepare countries for large outbreaks and particularly pandemics. So, in my 30 plus careers, 30 years or so of public health career, for 27 years, I worked for the US Centers for Disease Control before joining WHO.
So as a global public health leader, can you speak about, the way the world is tackling COVID-19, especially, given the inconsistent approaches across the world?
Yeah, so I think, first of all, the worldwide reminders and a lot of efforts by public health organizations, CDC, World Health Organization, other international organizations in public health, despite efforts to sensitize countries to prepare for a pandemic and large outbreak. Mostly all countries were found unprepared for a pandemic. So that's the first lesson we've learned. And then the responses have been really, really inconsistent. Some countries have really made very good responses and efforts to control the pandemic. Most recently, the biggest challenge is the inconsistency around vaccine distribution. Of course, the high-income countries are getting all the vaccines, and low middle-income countries are paying exorbitant prices to get some vaccines, and the lowest income countries are hardly getting vaccines, and the vaccines that they're getting, not all of them have the efficient systems to give those vaccines to people who need them the most.
Yeah, this just leads me to my next question. So do you think that the United States, such a well-developed country, should be doing more to aid other countries, in terms of vaccine accessibility to battle this pandemic?
No, absolutely. And I think U.S. government has started to tackle this, and they've started to donate large volumes of vaccines for low-income countries. But certainly, U.S. needs to do more, not only in terms of direct funding and direct donation of large vaccines, but also encouraging other high-income countries to also donate more vaccine. I think thirdly, it's very important that the way the vaccines are being hoarded by some of the high-income countries. So I think in terms of the behavior, we have to change that also, so that some proportion of vaccines manufactured should really be prioritized for shipment to low-income and low-middle-income countries. Because until we do this, we really won't get ahead of this pandemic. So I think we need U.S. as a leader should bring in some discipline across the board for equity.
So in your opinion, what are the top priorities that you would like to see to help the world overcome the COVID pandemic once and for all? And is overcoming the COVID pandemic even possible?
I think in the long run, it is possible, because now we have learned a lot compared to, at the start of the pandemic. We know a lot about this pandemic. Particularly, we're learning a lot how effective vaccines are. So I think most importantly, making sure that the key pandemic control elements, which is vaccination first and foremost, but also being very careful in terms of the physical distancing, wearing a mask, things now we know
Yep.
really work. Applying them systematically is important. But I think in the end, it is going to be large scale vaccination and the interim being very disciplined around wearing a mask and around hand washing and around maintaining physical distance. And then also the core public health capacities for the countries to be able to detect and diagnose cases of COVID, because without surveillance, you cannot fight any virus. And pandemic is this pandemic virus, SARS-CoV-2 is no different.
So, as someone who is already working, at the WHO, have you had to switch gears and help with the COVID pandemic at all?
Yes, in the region where I work, the most readily available on the ground public health capacity to deal with the pandemic was the polio eradication workforce. These were trained, it's a trained workforce that knows how to do disease surveillance, to identify cases of COVID, investigate them, get them tested in lab. Okay, so that public health surveillance I was talking about is very important. They had the capacity for data management. They had the capacity to distribute large volumes of supplies and personal protective equipment to communities. And this is mostly in areas of low income, is where we are still fighting polio eradication in countries like Afghanistan, Pakistan, Somalia, Sudan, and these areas. So the polio eradication infrastructure, the workforce and processes were really have been at the front lines in dealing with the pandemic.
So, how has your background with globally combating polio helped your understanding with the global battle of COVID-19?
Because the fundamental public health issues are very. First is that you do need good public health surveillance systems to be able to detect and track the disease and monitor the impact of interventions you're making. So polio eradication in that sense is no different from the COVID pandemic. Second and very important lesson is that a vaccine that is effective and prevents disease and prevents hospitalization and deaths is no good if it is sitting on a shelf.
Yeah.
It only works when you actually get it into the arms of people. We've learned that the same thing in polio. If you don't give polio drops or the polio vaccine into the children, it doesn't work. Okay, and so that's a very important lesson also in this COVID pandemic, that we have to get the vaccine out and get the highest risk population vaccinated. And then thirdly, it's very important that we develop strong health systems, public health systems, so that we can be more effective in dealing with the next pandemic.
Definitely. So, as someone who works with epidemics and pandemics of different diseases, what are some of your key professional takeaways that you've gleaned from the COVID pandemic?
First and foremost is we must invest. The world must, all countries must invest in their basic public health capacities of disease surveillance, being able to use large public health workforce to stop large outbreaks and stop pandemics. So preparedness is very, very important, right? Secondly, that means that you have to invest financial resources, because it is a lot more expensive, as we are finding out, in dealing with an outbreak and a pandemic than actually it costs to prevent and rapidly control an outbreak. So again, investment in prevention is absolutely essential. And third is that this requires collective global action to be effective. Very important lesson. So if the high income countries are going to hoard all the preventive measures, supplies, vaccines, the pandemic will continue, and it will get even more complicated, as we are seeing with the emergence of different variants that are much more transmissible, and against which some of the vaccines don't work as well. If we are able to distribute vaccines, very rapidly across the world, including particularly in low income countries, with that equity, with collective public health, global public health action, we can get ahead of the future pandemics much faster.
Yeah, definitely. Dr. Hamid Jafari, thank you so much for joining me. It's been a real pleasure.
Pleasure talking to you, Mohammed. Take care.